Spravato is the only nasal spray treatment used for treatment-resistant depression. And treatment-resistant depression is anyone who has taken 2 or more oral antidepressants and have had an inadequate response to those medications. Any individual that has taken 2 oral antidepressants and have had an inadequate response meets the criteria for Spravato treatment. The FDA requires that an individual have taken a minimum of those 2 oral antidepressants. And then it's up to the patient's provider as to the next step. And Spravato can be that next step. Anyone who has a history of any type of aneurysm, stroke, malformations should avoid taking Spravato. The FDA requires that Spravato be taken in conjunction with an oral antidepressant. So you must be on an oral antidepressant to qualify for Spravato treatment. Spravato is self-administered, but it's done under the supervision of a staff member at the treatment center. So REMS, which is Risk Evaluation Mitigation Strategy, is a monitoring agency that sets the requirements for that. So patients have to be in a REMS-certified treatment center to receive the medication. If the patient does self-administer it, the staff will hand it to them. They'll administer 1 spray in each nostril, and then they'll receive, and it happens within 5-minute intervals. The first dose is the 54 milligrams, which is 2 units that they'll receive within 5 minutes, and then moving forward, they can get the max dose, which is 84 milligrams, which is 3 units. They'll receive the medication over a 10-minute time period. The most common side effects are sedation, dizziness, dissociation. And dissociation is that feeling of out of body, feeling a little disconnected, arms feel a little bit longer or shorter, so some perception things. Those are the most common. Sleepiness. The good thing about Spravato is that these side effects come on quickly. Usually the peak of the medication is 40 minutes. Around that 40-minute mark is where patients will experience the strongest side effects. But as quickly as they start to experience the side effects, the medication starts to come out quickly. So they usually last about 20 minutes in my clinical experience. It's about 20 minutes. And then the symptoms are resolved within that 2-hour time period that they're being monitored in the treatment center. So the minimum time requirement is 2 hours, and that is FDA regulations, that the patient must be in the treatment center for 2 hours and to be monitored. And those requirements are there because Spravato can cause an increase in blood pressure. So we monitor the patient during that 2 hours to make sure that their blood pressure is in a safe range. And then we make sure that all of these side effects are resolved before leaving the treatment center. When I talk to my patients, we always talk about lifestyle changes. And for patients who experience depression, it's difficult for them to have that motivation to make those major changes in their lives. So one of the good things about Spravato is that once they start to get relief from the depression and they're starting to feel better, then we start talking about making some of these lifestyle changes, improving their diets, getting a little more exercise, trying to force themselves to be a little more social to get it. So those lifestyle changes are important, but it's different for each patient, depending on their progress and where they're at in the treatment cycle. One of the most impactful patient stories that I have was a female who had suffered with depression for over 40 years. She had suicidal thoughts almost every day. She and her husband built a new home, and the home had a 2-car garage. And she told me that she woke up every day thinking about how she was going to end her life in that garage. The thoughts became so intrusive that she and her husband sold the home. They moved and they bought a smaller home. I saw her, she came in after her first treatment. She told me that her suicidal thoughts stopped. She hadn't had a single suicidal thought since the first treatment. It took a while for the depression to resolve, but it took us 4 or 5 months before she felt she was in a really good place with the depression. But the suicidal ideation stopped after the first treatment. And she was tearful when she came back in for her next treatment, telling me that it's the first time in 40 years that she woke up and didn't have thoughts of wanting to end her life. So it's pretty significant. And it's why I do Spravato, is because I believe in Spravato and I see it change people's lives every week. The reason I feel that Sozo is at the forefront of Spravato treatments is that my main focus is Spravato. I don't see medication management patients. I only do Spravato, and that gives me the opportunity to meet with each patient. Before each treatment, I go into the room with the patients, I sit with them, I talk with them. They let me know whether or not they're having a good week, a bad week. We talk about what made it a good week or a bad week. And that allows me to build that rapport with the patient, and I get to know them, and then we can start talking about different strategies, because I get to spend that time with each patient. And we want to make it a very personable experience, not coming in and being a number. We want to make sure every patient gets their needs met.